There's a lot going on in your pelvic bowl, and many of you have probably experienced some sort of either digestive issue, reproductive issues, surgery, polycystic ovary syndrome, different issues with the uterus. All of this can cause adhesions and scarring in the abdominal area. And that absolutely can affect creating and maintaining tension in the iliacus and the psoas. But you may be wondering, how do I manage that and how do I support myself in that when I'm using the hip hook? So the hip hook and the ball are useful to help release tension in those muscles, the iliacus and the psoas. But when you have abdominal adhesions and you've had a lot of trauma in your abdominal area, it's very common for it to be very sore. So I would first look at the video that I created on how to decrease the pressure of the hip hook. There's lots of great tips in there about how to use the hip hook in a way that's maybe not as intense to start out with. The other thing to note, though, is that the hip hook could be an essential tool to help you resolve these adhesions that are in your abdomen. One of the most effective ways to release adhesions is to hold them or have something that is kind of pinning them and then moving your body around that pin. So I'm going to show you a little bit about what I mean here. So positioning the hip hook in the area of the pelvis, right next to the pelvic bone where the iliacus lives. I may not want to put a ton of pressure on it because it's tender and I'm sensitive because I have abdominal adhesions. But from this position, I can move my leg back and forth like this, which will help mobilize. Those adhesions are being pinned by the tool and I'm moving my leg around those adhesions. Similarly, I can move my body up. I can twist and rotate my body, my torso, and all of this will help to mobilize and release some of those adhesions. Similarly, I can take my leg and lift it up off the ground and down really gently. That will cause some mobilizations as well. And then doing some exploration where I maybe move it up a little bit and move my body around it, or down a little bit and move my body around it. So there can be flexion and extension of the leg, lifting up, moving the torso around this pivot point. So the very similar technique to when you find an adhesion in an area, like an active release technique, for example, where you put pressure on it and then you move your joint through space to help mobilize that adhesion. So there's really two things you're trying to do here with the hip hook. You're trying to use it to pin those adhesions and move your body around those to help release that. And you're also trying to put prolonged pressure on the iliacus and psoas muscle, which are also probably tight. So I hope this helps you and your journey. And if you have any other questions, please feel free to reach out to us.